Hand washing is something many of us do frequently during the course of a day. But in a healthcare facility, it can make the difference between life and death for a patient and a doctor.
There are tremendous efforts being done in hospitals around the country trying to minimize the impact of these infections, and I think these results are encouraging and show that, at least suggest that these efforts are having an impact.
Dr. Alexander Callan of the U.S. Centers for Disease Control and Prevention reviewed data from hospitals in 9 metropolitan areas of the United States. The hospitals were utilized by millions of people who could have brought methicillin-resistant Staphylococcus aureus, or MRSA, onto the premises, or been exposed to it either as healthcare workers or patients.
Can you lean forward for me?
Previous data reported to the CDC showed that MRSA was growing at a dramatically higher rate from 1974 to 2004. From 2005 through 2008, there was a significant decline.
Over this 4-year time period, there was about a 28% decrease in these serious MRSA infections that start in the hospital. There was also about a 17% decrease in these infections that start in people outside the hospital but are in people who have contact with the healthcare system.
When left unchecked, MRSA can be life-threatening as it spreads through the bloodstream and the bone.
The difference between this staph bacteria and other staph bacteria is that it tends to be resistant to some of the common antibiotics that we use to treat these infections.
Researchers say educational campaigns reminding hospital workers, patients, and the public about the dangers of MRSA may be responsible for the drop in the infection rate. Recently, the World Health Organization called on countries to prevent and control the spread of antibiotic-resistant bacteria through the rational use of antibiotics and stopping the sale of antibiotics without prescriptions. The study was published in the Journal of the American Medical Association. Carol Pearson, VOA News.